Otitis media is the term used to refer to an infection of the middle ear. This usually results from an infection in the nose, throat, or sinuses that spreads to the ear. This type of infection is more common in children because their eustachian tubes, which drains the middle ear to the back part of the nose, is more horizontal and shorter. Signs and symptoms of an ear infection include fever, ear pain, decreased hearing, and congestion. Smaller children may not have many complaints and may only be fussy. Middle ear infections can be caused by viruses or bacteria. If the infection is caused by a virus, antibiotics will not help. If the infection is caused by a bacteria, antibiotics will be needed. The American Academy of Pediatrics and the American Academy of Family Physicians recommend a wait-and-see approach for some cases of otitis media. This approach was designed to limit antibiotic usage as many middle ear infections are caused by viruses. An overuse of antibiotics may make antibiotics less effective if your child has another bacterial infection in the future. It has been determined that the wait-and-see approach can be followed for your child's otitis media. Your child may have been given a prescription of antibiotics, but your emergency department provider recommends that you wait 48 hours before starting them. You may give your child an over-the-counter medicine such as acetaminophen or ibuprofen for fever or pain. It is important that your child stays well hydrated and drinks an adequate amount of fluids. If you feel like your child's symptoms are worsening, you should contact your child's pediatrician. They may ask you to start the antibiotics or return to the emergency department. It is also important that your child has very close follow-up with his or her pediatrician. You should contact their office for an appointment as soon as possible. It has been determined that it is safe for your child to be discharged. There are some instances when complications can develop. Therefore, you should contact your child's pediatrician immediately or return to the emergency department if he or she develops any of the following: pain worsens, your child is not able to drink fluids, persistent vomiting, no improvement in 2 days, any pain or swelling behind the ears, any confusion, fever persists, severe headache, your child's condition worsens, new symptoms develop.